Hey guys, we all eat a variety of items, but what we eat does matter because when we eat spicy food that cause gastritis, not only spicy food but there are so many other foods and other items that cause gastritis. Gastritis occur commonly, but it can cause huge damage to the entire digestive system. So, what is this gastritis and how can we get rid of them? Gastritis, it is an inflammation of gastric mucosa and it is classified as either acute or chronic. It is one of the most common problems affecting the stomach. It results in the breakdown in gastric mucosal barrier, stomach tissue unprotected from autodigestion by HCl acid and pepsin. Men's are more affected than women's. Etiology and pathophysiology of gastritis. What are the risk factors? In drugs, aspirin and non-steroidal anti-inflammatory drugs are the risk factors. In diet, alcohol, spicy food, and extremely hot food consumption, etc. So many things are there. They can cause gastritis. Microorganisms. Helicobacter pylori and Staphylococcus organisms can cause infections which can lead to gastritis. Environmental factors which cause gastritis are radiation, smoking. Pathophysiologic conditions that cause gastritis are burns and renal failure. And some other factors are psychological stress and NG tube. Autoimmune atrophic gastritis risk factors. It affects fundus and body of the stomach and it is associated with increased risk of gastric cancer. They may be linked to presence of Helicobacter pylori and development of autoimmune chronic gastritis. Pathophysiology of gastritis. The mucosal lining of the stomach normally protects it from the action of gastric acid. This mucosal barrier is composed of prostaglandins. Due to any cause, if this barrier is penetrated, then HCl come in contact with the mucosa and it may injure two small vessels, which causes edema, hemorrhage, and possible ulcer formation. What are the clinical manifestations of acute gastritis? They are anorexia, nausea, vomiting, epigastric tenderness, feeling of fullness, hemorrhage. Hemorrhage is most common with alcohol abuse and maybe only symptoms will be there. These images are taken from the endoscopy. In this image, acute gastritis and chronic gastritic images are shown. Diagnostic studies of gastritis. Endoscopic examination with biopsy. It is necessary for definite diagnosis. Breath, urine, serum, stool and gastric tissues to determine Helicobacter pylori. How to get rid of this gastritis? Take a garlic extract supplement. Drink tea along with honey. Avoid smoking and overuse of painkillers. Try to reduce your stress. Try to walk around for a while. Intake of food in small quantities will help you a lot. Some complications caused by this gastritis are bleeding, pernicious anemia, and gastric cancer. If you have any doubts or want me to improvise, let me know in the comment sections below. Thank you.